Struggling with anxiety or mental health issues? Even though medication is an important topic, here's a second important reason why online helpers and content creators do not belong in that discussion. Okay, so what's the second reason why people like me shouldn't or don't talk about medication or answer medication questions? Well, in simplest terms, I will say because it's complicated. It is. It's very complicated. There are so many different variables that go into this. So many different variables that go into this. There are individual physical, physiological, and medical variables that go into this conversation and these decisions. There are social and family variables that go into this decision. Your family might be vehemently against medication or very for medication and Western medicine. Your family might be heavily invested from an emotional or cultural standpoint in Eastern healing philosophies or spiritual beliefs. So that factors into it. There are financial variables. Not everybody can afford the medical care that leads to the protracted use of medication. We got to take that into account. There are cultural variables. And honestly, especially in the US today, and not to get into it too much, but it's hard to argue that medicine and medication, things that come out of pharmaceutical companies, are not cultural now, because we're experiencing a really big cultural divide at the moment. And that's one of the issues, or that's one of the areas that is dividing us, at least in the US. And it seems to be in certain other Western countries as well. Again, from segment one, first principle, beliefs and autonomy, everybody gets to pick their own path. But that's one of those variables that goes into that, right? There are lifestyle variables that go into this. I have no idea what lifestyle you live. I don't know what your job is. I don't know what your demands are. I don't know if you have kids. I don't know if you're in relationships. I don't know if you're caring for an elderly parent. I don't know if you have pets. I don't know if you're active in your church or community. Like, these things go into that as well, because sometimes when we use medication, there are side effects that may impact your ability to live the lifestyle that you want to live. So that has to be factored in. There's your history with medication. So when we talk about medication, medication itself is a variable. Have you used meds before? Psychiatric medications or medications in the anxiety and mental health context? Are you using any other medications? Do you have any other medical conditions that are presently being medicated? Because that may play a role in whether you can or cannot take the usual medications that are prescribed in anxiety and anxiety disorders. And then there's your specific presentation. Like, everybody's going to show up presenting in a different way. While the principles, say, of OCD or health anxiety or panic disorder are the same from one person to the next, the way it shows up in someone's life, the obstacles it creates, the way it impacts their lifestyle, their functioning in many different domains is going to change. So it's also going to depend on your specific presentation. Like, there are so many variables that go into, should I take a medication? Can I take a medication? What kind of medication? What dose? Can I do it without medication? There are so many variables that go into this that you have to get to know somebody. It's frankly, in my opinion, and I will give you my opinion here, it seems patently absurd to think that some dude with a microphone who's talking to 20,000 people on YouTube or 100,000 people on Instagram would know any of you to any sort of degree that would qualify me, even if I was medically trained, and that's what I'm going to talk about next, to give you any kind of actionable advice when it comes to medication. There are just too many variables that go into this, right? And while we're on the topic, qualifications and training do matter. So unless you are watching a video or listening to a podcast or seeing a post or reading a blog or a book written by a medical doctor or someone in pharmacology or specifically a psychiatrist, at least here in the US, somebody who is neck deep in qualifications, training, and knowledge about the use of psychiatric medications, you probably shouldn't be asking about psychiatric medications. Now, as a therapist treating anxiety and anxiety disorders, I have medication discussions with my clients all the time, but there is a scope within which I must stay. We can talk about it. I can help them sort of work out the issue when they're unsure of what to do, because that happens to pretty much everybody. A lot of people become unsure of what to do. That's okay. So your therapist can sort of help you work through those things. And I have enough base information to help people make their own well-informed decisions. But otherwise, I can't tell you that much about what those meds are going to do for you or not do for you, or if they're going to work, or if you need them, or if you don't need them. I'm not even sure about that when it comes to people that I talk to and get to know intimately. for weeks or months or even years on end. So it's simply not possible for somebody in this environment, again, one to many, one person talking into a camera or a microphone that many people are listening to or watching. We can't possibly know enough about you to give you actionable, safe, ethical, okay information about your medication. So that's the second reason why we can't really talk about this and why I don't answer the questions when I get asked. Today, we looked at a second reason why it's really important that we be very careful about how we discuss mental health medications in online circles. Primarily, it's complicated. Everything is complicated. That's not news, but this especially is really complicated. So it makes this kind of discussion really dangerous if we're not careful. So part 3 of this little mini series on medication chat is coming out tomorrow. If you're watching this on the day that the video is released, or if you're watching in the future, well, it's already out. And if you've liked the first video and this video, maybe go check out that third video. And while you're at it, of course, I'm going to ask you to do me a favor and hit the like button if you like the videos, and subscribe to the channel if you like what you see here, because while they're small clicks for you, they definitely help me out. Again, I hope you got something out of this. Maybe you learned something. Maybe you learned something about me. Maybe you learned something about yourself. Maybe you had some questions answered. Who knows? But either way, I hope it was useful for you, and I hope I see you in the next video.